You may think that bioidentical hormones are only for menopausal women, but they actually have many more benefits. And here to tell us more is Dr. Russell Bartels. He is from the Scottsdale Center for Women's Health. So who is a good candidate for bioidentical hormones?
Well, it's a great question, and it's a lot different than what many of the viewers might think.
Okay.
Last time I was here, and we had a great response, and patients came in and they're feeling better for having come in, but we focused on bioidentical hormones in kind of a broad aspect.
Okay.
And today I kind of want to focus in on testosterone as one of the primary hormones that many patients could benefit from.
So when I think testosterone, I think men.
Right.
So, but you use this for women?
Correct, and it's a very underutilized hormone for women.
Okay.
The ranges of testosterone dosing is definitely different for men and women, but women definitely benefit from testosterone, and they have testosterone produced naturally in their body.
Right.
And it's one of the most underutilized hormones for women. I mean, there's testosterone receptors in the brain, in the heart, in muscle, in the vagina. There's testosterone receptors that, when stimulated, can have very beneficial effects.
So what kind of things can this type of hormone, right?
Right.
What kind of things can it help? I know earlier I heard you mention fibromyalgia.
Fibromyalgia, which is a condition that's not very well understood, but characterized by a lot of aches and pains, even mood disorders, depression, and we're finding fantastic improvement in most of those symptoms.
Right.
And maybe getting patients off some of their chronic medications that they use for these conditions.
Right.
By just giving a natural bioidentical hormone, testosterone. And we're seeing improvements for patients with migraines. That might be their only complaint. And they've been treated by the neurologists as best the neurologist can do for them, but with medications. And we give them testosterone. And it's amazing. Within a month, 2 months, they come back and they say they haven't had a migraine since we placed the testosterone.
Oh my gosh, and for the people that get migraines, that's huge, especially for their loved ones that have to deal with it as well.
Yeah.
Do you guys treat men also?
We do treat men also.
Okay.
And I started my career in medicine as a OBGYN, board certified, and that's the majority of what we do, but we've expanded to treat men. Primarily, it started as the husbands and boyfriends of our female patients who were wondering if they could enjoy the benefits that their wives and girlfriends
Right, good
were.
question, right?
So we've been treating men for a couple of years now with great success.
Now, how do you administer these hormones?
Lots of different ways. To name a few, there's oral administration, there's topical creams that you can apply nightly, there's patches, and there's pellets.
Okay.
And we find that the pellet delivery system, and it's a small pellet like the size of maybe a Tic Tac for the women. The men's pellets are a little bit bigger and we use more of them, but they are little implants that go under the skin, usually on the buttock area, and with a painless procedure in the office, takes about 5 minutes to do. And it mimics the body's own physiologic response better than any of the other methods that I mentioned.
How soon do you see results? Because I'm sure people out there with the pain and just not feeling well, they want instant gratification.
Exactly. And for some conditions, we will see improvements within a few days to a week or so. That might even be when we treat with estrogen, for instance, hot flashes, night sweats.
Right.
But when it comes to fatigue, migraines, aches and pains, it can take a month or so. I usually will follow patients up in about a month. They'll come in after we've placed the pellets, and whenever I open that door, I'm always wondering.
The smile on their face.
And nine times out of 10, it's a smile. I'm feeling better.
Right.
And we don't create Superman or Superwoman in 4 to 5 weeks, but there's a vast improvement for the majority of patients in that short time frame, and then we build on that.
Right.
And it's a very well-tolerated hormone with virtually no side effects.
All right.
It's almost like a wonder drug to treat many conditions.
Well, and you guys have been doing this for quite some time, and you understand women, you understand men.
Correct.
So now I think for all of those out there that are ready to start feeling better, we want to send you to Scottsdale Center for Women's Health. The information is right there. You can reach them a couple of different ways. You can call them at 480-425-8700. You can go to vitalityhormones.com, or you can go to ScottsdaleOBGYNS.com and get all of the information there, and they'll start getting you feel better.